Good afternoon. It's Monday at 12:30, so that means it's time for the weekly briefing brought to you by the Emergency Leadership Team. I'm Dr. Ruth Jackson, Vice President for Academic Affairs. And as always, I'm joined by my colleagues on the Executive Policy Group, Vice President Teresa Powell, Dean Joshua Snavely, Dean Joshua Busby, as well as Chief Mario Holland. Today, we're joined as well by Vice President Dr. Matra Jones. She serves as the Vice President for Institutional Advancement and External Affairs. We have some special guests that we will introduce to you a little bit later on in the webinar. So for today's webinar, we will begin with our regular status update for COVID-19. We'll talk about testing requirements for our residential students. We'll provide an update on vaccinations, and we'll end, as we always do, by reflecting on resilience. At this time, I'll ask Chief Holland if he will provide our updates. Chief.
Thank you, Dr. Jackson, and good afternoon, and welcome to the webinar, everyone. Today, as of noon, April 12th, the total COVID-19 cases for the state of Oklahoma had a 0.5% weekly increase. The number of active cases in the state of Oklahoma had a 5.6% weekly decrease. And for the deaths in the state of Oklahoma, that information has kind of changed a little bit, but we are still awaiting accurate information. And so that statistic is pending a new report. And once we have that information, we will be keen to give that information to you all. For Logan County, the total cases had a 0.5% weekly increase. And for Logan County, the active cases had a 10.2% weekly decrease. And the unfortunate news for deaths in Logan County had an increase, and the number is at 56. For the university, the total cases is at 103. And the great news, we do not currently have any active cases for our university. And with that, now I will ask Dean Busby to share with you all some information about COVID-19 testing for employees and students. Dean?
Thanks, Chief. Good afternoon, everybody. As it relates to this week, of course, we know that our faculty and staff, as well as our students, are encouraged, to utilize our complimentary testing service that's available through our partner, Total Wellness, to help us to mitigate the spread of the risk of COVID-19. And so on our campus this week, we're actually offering testing right now in the multi that started at 12 p.m. And it will end at 4 p.m. We will not be offering testing tomorrow, but we will be offering testing on Wednesday from the same time, 12 p.m. to 4 p.m. And we're extending the time frame on Thursday and Friday, of which I'll give a little bit more information as to why for our campus-wide testing, which will be 11 a.m. to 7 p.m. on Thursday and Friday of this week. And we will not be offering testing on our Oklahoma City or Tulsa campus. As part of our ongoing surveillance testing program, we're going to continue our campus-wide testing requirement for our students that live in campus-wide housing. And we'll be doing that again, as I stated earlier, this Thursday and Friday. We'll be able to offer that from 11 a.m. to 7 p.m. Students will be able to test anytime within that time frame. The link has been sent out via public relations, and there's going to be a few more emails and messages that's going to be going out with that sign up link to where students can make their appointments to sign up in the Calendly system. Of course, our students should be very, very familiar with that system to where they can select the time that they would like to be tested on Thursday or Friday. Students, of course, that's just one test. You can either test on Thursday or Friday. The choice will be yours to be able to test. And so at this point, I will turn it over to Dean Snavely to talk about our University Vaccine Administration Program. Dean?
Thanks, Dean. They just started mowing right outside my window, so it may be a little loud for just a second. We are excited about the launch of our vaccine administration program. We've been talking about this for the last several weeks. We're grateful to everyone who was able to fill out the survey. That really helped us get accurate information. And at the end of last week, we got the news that we would be able to offer vaccinations to our campus community tomorrow. So happened pretty quickly. So we were glad we had all of that in place. A message was sent out last Friday. There'll be another message going out today. The type of vaccine that we've been offered through the partnership is Moderna. Again, we'll be doing that vaccination administration tomorrow, Tuesday, April 13th, from 9 a.m. to 3 p.m. in the multi. This is on the Langston campus. Appointments are required and they'll be offered in 5-minute intervals. And so there's approximately 250 slots that are available for tomorrow. We'll be setting a date, talking just a second about the second round because Moderna requires 2 doses. There's no cost to employees. The vaccine is provided by the federal government to the state of Oklahoma. And then the state of Oklahoma works on partnerships and vendors to provide the labor associated with the administration of the vaccine. So it's possible that folks will be billed from an insurance standpoint just for that labor, but there's no cost for the vaccine. And if you don't have insurance, the vendor Total Wellness will work to bill the state. So no cost to you as a result of this opportunity. We're really excited about it. Glad we could make it happen so quickly. We've had lots of people sign up already, and many more we know have told us that they will. The deadline is tonight by midnight. So got about 12 hours to sign up. That deadline is important. We have to know as we get ready for tomorrow how many we are administering. There's a whole process around how they secure these from the state. So we want to make sure we have an accurate count. In addition, everyone who signs up today will get a message with the paperwork they need to fill out and bring tomorrow. So we can answer more questions about that when we get to the Q&A. But those are the basic details. Again, we'll send another message today, and VP Powell has a couple more details she's going to share with you now.
Thanks, Dean Snavely. So if you've looked at your email that we sent last week, you will have seen this link, and we know that several of our community members have already completed the appointment information to secure their appointment for tomorrow. So this again is open to all students, faculty, and staff who wish to receive a vaccination through this initiative. You can find the link that is on the screen. We'll also be sending a reminder email, a companion email to the email that was sent last week. You can expect to receive that through your Langston University email following today's webinar. If you have questions about the vaccination initiative or how to secure your appointment, please don't hesitate to reach out to us at luelt@langston.edu. And Dean Snavely mentioned in his introduction that we want you to save the date for the second dose. The Moderna vaccine does require a second dose. And to ensure that we're able to catch all the students who want to receive the second dose before they leave campus at the end of spring break, we're going to be offering that second dose on Thursday, May 13th. It will also be held in the multi on the Langston campus, and we'll follow a very similar process. We'll send out a link to secure an appointment in advance, and we'll be sharing that information with the university community in the coming week or so. So please let us know if you have any questions. With that, now I'm going to ask Dr. Jones to introduce our distinguished guests. Dr. Jones.
Thank you very much, VP Powell. I am honored to present to you today our student moderator as well as our panelists, our distinguished panelists. Caitlin Golston is a senior at Langston University, majoring in public health from Dallas, Texas. She serves as vice president for the Langston University Public Health Student Association and is very active in the organization. Caitlin will be assisting the EPG in moderating today's webinar and will be posing questions that we received from students and other stakeholders today. Our first panelist is Dr. Noor Jihan Abdul-Haqq. She's a board certified pediatrician from Oklahoma City and a proud graduate of the Oklahoma School of Science and Math. She graduated from Spelman College with honors and with a degree in biochemistry, and her medical school and residency training were completed through Morehouse School of Medicine, where she was active with various medical organizations. She's done medical work in Barbados, Dominican Republic, and Mexico. Her awards include the Leonard Toe Humanism in Medicine Award, Practitioner of Excellence Award from Sisters United Organization, Journal Records Achievers Under 40 Award, and Outstanding Minority-Owned Business Leader. This summer, she received a regional award for her work in the Oklahoma City chapter of Jack and Jill of America for providing STEM opportunities for youth. She also led an effort to create a gap funding scholarship for our students and help some of them get to graduation for this upcoming commencement. She's been interviewed numerous times for local radio, television, and print media. Dr. Abdul-Haqq opened her practice, Peace of Mind Pediatrics, in September of 2015 to serve the community that she grew up in. She will be opening a second location this spring. She serves as a mentor for high school and college students and has assisted other physicians with starting their own practices. In September of 2020, she helped open the Clara Community Health Center in Oklahoma City, which is a free health clinic for the uninsured. She's a member of Masood Mumin in Oklahoma City. She and her loving husband are the proud parents to 3 wonderful children. Our second panelist, Dr. Christopher Harris, is a third-year family medicine resident physician at the University of Oklahoma Health Sciences Center. He's originally from Tulsa, Oklahoma, and earned a Bachelor of Science degree in biology from Jackson State University. He then returned to Oklahoma and earned a Master of Public Health degree in Health Administration and Policy and a Doctor of Medicine degree, both from the University of Oklahoma. Dr. Harris is one of the chief residents for this academic year. His interests include African American health, maternal child health, healthcare quality improvement, and improving diversity in the healthcare student population and workforce. When he finishes his residency out of state, he will come back to Oklahoma and serve as faculty for the University of Oklahoma, and we're happy that he will be coming back after he's finished. When he's not taking care of patients, he enjoys spending time with his wife, Alicia, son, Carter, and 3 dogs. He enjoys golf, fishing, cooking, and playing bass guitar. So as I shared earlier, we collected questions from various stakeholders, including students, and we're going to go ahead and get started. And this is for both of our physicians. Have you worked with COVID-19 patients or patients impacted by COVID-19?
I can start. I'm mostly outpatient, as mentioned. So in our clinical setting, yes, children do get COVID-19, and some have been ill. I have had to hospitalize a few of my patients, mostly for fluids, but also sometimes they'll have they'll have elevated liver enzymes and things like that. So we have to work them up for a syndrome that can impact children that can be quite, not necessarily deadly. For few children have died from this, but it also can cause a lot of what we call morbidity or just long-term issues later in life. And I also see babies in the hospital. And so we've seen a lot of pregnant women who have had COVID-19 and had to take care of those infants. Most of those infants have done well, but we do know that women who contract COVID-19 while pregnant are at increased risk of actually going into the ICU, et cetera. So a lot of those women are even having premature babies. And so of course they're at higher risk. So yes, we are seeing a lot of different things and definitely had that exposure.
And I also am mostly outpatient, do some inpatient medicine as well as some obstetric care, and definitely have had a decent number of pregnant women who've been COVID positive. Urgent care that I worked at one point, we were seeing about 30 people a day that were testing for COVID, and about 2/3 of them were positive. So definitely seeing a lot of it. And at OU, the Family Medicine Clinic, we're responsible for the monoclonal antibody infusions, and so consulting and getting consent for patients for those procedures as well. So it's definitely had a huge impact on our system and changed the way that we do medicine.
Have you personally received the vaccine? Which one, and why did you choose to receive it? Again, for both of our practitioners.
So I have received both. I received the Pfizer vaccine. I completed the series at the beginning of January, and that was the only one that was available to the state of Oklahoma at that time.
I completed Pfizer as well. I did, you could say that I did have a choice, but at the time it was very difficult to find slots. And so I just selected whatever I could get whenever I could. I will say that my staff Some of them got Moderna, some of them got Pfizer. We literally just were trying to see what we could get. So my parents got Moderna, I got Pfizer, and my sister got Johnson & Johnson.
Thank you. I think Ms. Golston has a question at this time.
Yes. So this question is for Dr. Harris. The vaccines came out quickly compared to vaccines in the past. So what are the ingredients of the vaccine, and can you talk a little bit about the science, medicine, and technology behind the vaccines?
Sure. So the ingredients of the vaccine, there's a lot of different things that go into it, small binders and things of that nature. But the science of these vaccines are based on something called messenger RNA or mRNA. And so what mRNA does is that it recognizes, it's a transport system. And so you recognize this specific protein that's unique to COVID called a spike protein. It attaches to the mRNA. And then that is what is injected into your body. And once that's injected to your body recognizes the spike protein, mounts immunology response to it. So you develop these antibodies. The messenger RNA component dies and goes away pretty quickly, but your body has started forming the antibodies necessary to recognize COVID in the future. As far as the timeline of the development of the vaccines, I think that it appears rushed in a lot of ways, when in actuality, there's only a couple of small things that was rushed about the process. We have to consider the fact that we are in a social media era, and there hasn't been any real new vaccines in a long time, probably 15 to 20 years or so. And the general public is not aware of that timeline of what it takes to make a vaccine, and most physicians aren't aware of that timeline either. We are aware that it takes 10 to 20 years to make a new medicine and get a new drug to market from development. And so the clinical trials that were part of these vaccines were all part of the standard process. There wasn't anything that was rushed about it. What was rushed was the authorization of the use by the FDA. And basically, a lot of the paperwork and back-end stuff that's normally required wasn't required at this stage because it got approval under the emergency use authorization. And that does not mean that it is FDA approved. That just means that given the severe circumstance, we deem it to be safe enough and the risk of getting it aren't relatively equal to the risk of getting COVID. So therefore we need to get this out, and we'll continue to study it, and then we'll make a final determination. Plaquenil, which was the first medication that received EUA approval, was since not formally approved by the FDA. So I think that social media and news outlets have really sensationalized us to believing that this was a half-baked process, if you will, when in actuality, the development and the research behind it is not rushed, and the technology itself, mRNA, has been used to study vaccines for things like adenovirus and HIV for over 20 years. So it's old technology, new virus.
Thanks, Dr. Harris, for that answer. This question is for Dr. Abdul-Haqq. Doc, of course, we know that there are 3 different vaccines out. There's the Moderna, there's the Pfizer, and of course, there's the Johnson & Johnson. Can I choose which vaccine I would like to receive? Should I wait on any of the specific vaccines? Of course, you and Dr. Harris spoke about, the availability at certain times, a few months ago. And then lastly, is one vaccine better than another relative to one that I should choose to receive?
So the one thing is that we are now in a situation where you almost can choose which vaccine you want, whereas early on, you didn't have that option. And so I tell people all the time, there are some people who are like, I know I can't go back for that second vaccine. Like, I hate needles. I need to be one and done. And so last week, I actually had a Johnson & Johnson drive for a lot of those people so that they be one and done, since I knew that they wouldn't try to do a second one. In terms of, which one is better than the other, they're very, very similar. And what you'll see is that we're going to continue to get more and more data. Even the vaccines that we give on a regular basis do not have 100% coverage. So when people are like, well, I heard it's only 94. And I'm like, that is amazing. Like our MMR vaccine probably sits about 86%, in the person who completely mounts a perfect response. So it's very important for us to realize is that man is not perfect and cannot, create these things off, typically eradicate everything. But they've been able to get very, very close. And so we're finding out more about different strains of COVID in which vaccines may have had more studies in those areas. And so therefore, they feel that they may have a better chance against those other strains. But the strains are moving all over the place. So you can't say, unless you're in South Africa, right? And you're like, okay, the South African strain, I'm here, or you're in Europe or something. But here in America, we're seeing tons of them. So I wouldn't be able to say one is better than the other, even those that have maybe better coverage against certain strains, because that may not be the strain that you even come in contact with. So I definitely say if you have the opportunity that you should try to get the immunization. And if you're a person, in terms of, side effects and things like that, most adults have not gotten a vaccine in a really long time. And so our immune system gets revved up after we get these immunizations. So we may feel a little bit more tired. We may have a headache. You may have a sore arm, and you may just need to rest. And, I tell people, hydrate before you get your vaccines, try to rest, don't plan a whole full day after you get it. Allow your body to work, allow your little army, your immunization, your immunologic army to take, start working, getting their weapons, getting ready to go. And that's what I say, when you're getting the vaccine, you're revving up your army so that it can prepare itself if it ever encounters the danger, which would be COVID-19 or SARS-CoV-2 virus. And so that's pretty much what I tell people, that you're going to have side effects with all of them. I'll be honest with you. I've seen pretty much everyone having the same side effects with all of three of the ones that we have here in America. And I know later on, Novavax will probably get approval in the United States as well. But I tell people, if you're going to remain home, you're not traveling, you're not, going around others. Obviously, if you're a student at a university, you are at increased risk. So it's best to take the opportunity when it presents to you. And also while we still have the numbers, because just for example, there was a mistake at one of the Johnson & Johnson plants. So they had to destroy all of those doses. So now we're going to probably in the next few weeks not be able to have as many doses of that vaccine. So it's very important to know that other countries also want these. And, we may not have this privilege that we currently have, which to me is kind of amazing, because I didn't think we would have this sort of privilege, especially over some of the other countries.
I think now we have Dr. Jackson, who has a question for Dr. Harris.
Well, let's see. I will actually go to one of the questions in the chat. So Dr. Harris, what do you see as the benefits to student athletes considering the vaccine?
So I think the benefit to student athletes will be the same as it is to the general public, and that is that it will more than likely prevent you from, at the very least, developing symptomatic COVID. The vaccines they haven't been studied specifically to look at getting the ability to prevent you from getting COVID itself, but specifically about preventing you from getting symptoms from it. So how that specifically benefits the athlete is that it allows you to stay in your sport, even if you are positive, because you more than likely will not show symptoms. And if you do, they'll be extremely mild symptoms.
Thanks, Dr. Harris. see. So, Chief, you have a question? For,
Yeah, I think his question, or he's up.
okay, well, I have another question while we wait for Chief. Dr. Abdul-Haqq, what will this vaccine prevent me from getting COVID-19?
Well, as Dr. Harris just mentioned, we haven't determined that from our studies, and that data hopefully will, as the years go by, we'll really be able to see that. You have to have a certain number of the population actually, come in contact, and then you can say whether you've definitively been able to do that. But how many of us know exactly when we've come in contact, is that reported, et cetera? So I will say that, I look forward to that data coming out, because I've heard so many stories of people saying, well, I had my vaccine, I was with others who ended up testing positive for COVID, and I have been testing negative. So I look forward to seeing what information comes out of this. But for right now, we have to be careful of saying that, because we do not have any data. And that's why we still recommend everyone wearing their masks, socially distancing, and remembering that COVID is still here.
I think that ties nicely. Caitlin, I think, had a question about masks. Caitlin, do you want to ask that specific question about masks?
So do I need to wear a mask and avoid close contact with others if I've gotten 2 doses of the vaccine? And that question is for Dr. Harris.
So I would recommend to continue to do all of the standard precautions related to COVID, assuming that the people that you are with have not been vaccinated, or you don't know their vaccination status. In a group of people where majority, if not all, are vaccinated, then you can probably ease up on some of those precautions as far as wearing a mask. The distance required between individuals and vaccinated right now, I believe, is at 3 feet, which is a little bit shorter than the 6 feet standard social distancing. So going out in public, continue to wear a mask, just because we don't know. And this is something that I personally would not take a chance on. Although the likelihood is low, I wouldn't take a chance on happen to coming into contact with a different strain, or you might not be at full vaccine effectiveness yet, or things like that.
So I have a question for Dr. Abdul-Haqq. Do we know, I think you've gotten at it a little bit, but maybe talk a little bit more about how long we think immunity might last once you've gotten your second dose? And do we see, there's sort of talk right now about booster shots maybe in the fall or next year sometime. Can you address that?
Yes. So as of right now, Pfizer did release data that they say that their vaccine is effective for up to 6 months. And I do know that Moderna is working on a booster vaccine, but Moderna hasn't released, as far as I know, they haven't released that efficacy data yet on how long they feel like you'll have that. And a lot of people are wanting answers for things that we just can't give, because you have to live out that time period, right? So every time as the months go by, then we'll know how long these vaccines are effective. And I know that's very difficult for many, because you want to know before you take it. But it is one of those situations, as mentioned before, this is a pandemic, it's the emergency use. And so as we go along, I have a feeling that it will expand. Now, as you know, with like the flu vaccine, we do end up getting it each year. And so this virus was a difficult one to create into a vaccine. And so that's why, a lot of people feel like we probably will need a booster, and that, there's other strains already developing. And so the boosters will include the other strains. For those who do not know, that's how our flu vaccines are, is every year they look to see what strains are around. We typically get our information from like Australia, because their flu season is opposite from ours. And then we create our flu vaccine based on what strains we're seeing in other parts of the world who are different than ours, and then hoping that we've, been able to get the right strains. And so I definitely foresee us needing boosters in the future. Since this virus doesn't seem to be seasonal, it has persisted despite the seasons, and which is not as common for many viruses. So I do foresee us having to have boosters.
Thank you.
Thank you for that. I want to ask a question that one of our students proposed as well. If I've already recovered from COVID-19, is it recommended that I get the vaccine even though I've recovered from the virus?
So that's kind of like a dual answer question. It depends on if you got the monoclonal antibody infusion or not. That's one of the big things. So that could be anything like Carasivimab or Bamlanivimab or Iservimab. Those medications, if you've gotten any of those and you've had COVID and you've recovered, it's recommended to wait at least 3 months after you receive that infusion before getting the first dose of the vaccine. Now, if you have had COVID and you didn't get the infusion, then you can get it as soon as you would like to. There isn't any set guideline as to delaying getting the vaccine. Just want to make sure that you're not having any fevers or anything like that. And then once all that is good, you are free to go ahead and get the vaccine. Some people are getting the antibody test after they have COVID, and then making a decision on when they're going to get the vaccine based on the results of their antibody test. So if their antibody test is positive, they'll delay getting the vaccine until it's then negative, and then they'll get the vaccine.
I would just add to that, if the part of the recommendation, especially in the areas where we don't have as much vaccine, would be to wait the 60 to 90 days if you have fully recovered. But as he mentioned, you definitely can, but you should have some protection. And if you're not able to get an antibody test, I know many of you may not have access to that, but at the 60-day mark, you may feel a little bit better about getting it as well.
Yeah.
Dr. Abdul-Haqq, we had a quick question about, and I think this is an important one, and as we think about the misinformation and different things that's out there that Dr. Harris was mentioning earlier about social media, I've heard, and this is from a student, I've heard new quick vaccines have had long-lasting side effects for women in the past, as well as the African-American community. What does this look like for the COVID vaccines?
Well, we don't have that data yet for the COVID vaccines in terms of long-term side effects, but I would be interested. We don't actually have data of long-term side effects for any immunizations that I'm aware of. So I'm not sure where that information was necessarily spread. People will often say things, but if you actually look at the studies and you look at the data, that's not the case. One thing that's very important to pay attention to with immunizations or vaccines is that any and everything about a participant must be reported. So for instance, you'll look at the Gardasil trials and they reported someone died, and they're like, someone died. They were in a car accident, you guys. Like, you have to report every single thing. And so if you don't go and actually read the study or the data, then that can easily be spread on social media. And so if there were long-term effects for the vaccines, the CDC has to report those. And we give sheets to everyone talking about the side effects of vaccines. People just don't read them, right? But we don't have any that say that you would be at risk for some long-term issues. And I mean, I think most of our vaccines have been around for a really, really long time, and that information has not been disclosed or given to us. And I'm not familiar with any cases like as that person mentioned.
Great, thank you for that. So Dr. Harris, I want to go back. You spoke about antibody tests. And so in Oklahoma, where could one get an antibody test if they do not have insurance or Oklahoma insurance? We have, of course, a great vast majority of our students are from out of state, right? And in some cases, their insurance may not be accepted in Oklahoma for one reason or another. But if they wanted to get an antibody test, what specific options would they have?
So the antibody test in general, I'm not a big fan of. I'll explain why in a second, but it's very difficult to get these tests, and just because of their limited utility. So I would start with talking with your individual PCP to see if they or the lab that they're contracted with has the antibody test available. The reason that I'm not a huge fan of the antibody test is that it does not tell you at what point in time you may or may not have had COVID. It's looking at a very specific antibody that's a long-term response, not a short-term response. It would be great if it was the antibody that says, you know, okay, you have an active disease, because it goes up and then in a certain amount of time it comes back down. And even with that, the accuracy of it, if it is positive, is only about 60% or so. And so you have to have 2 antibody tests that both say positive to then truly consider yourself positive in the antibody test, saying that you did at some point between January of 2020 and now that you've had COVID.
I wanted to ask, so we've seen, there's another question in there about long-term effects. And I think for me, and I know all of our panelists on the Langston side have been vaccinated. And I know everyone wanted to share that at some point. And I think for me, in making the decision to get vaccinated, I looked at some of my colleagues and friends who have been experiencing long-term COVID impacts since they got COVID-19, and wondered if you might just comment on that, sort of balancing that personal decision, because it sounds like from the beginning you both have seen patients who've been, their lungs, breathing, they've experienced long-term impacts from getting the virus. And so a part of our decision in getting the vaccine has to be, is there less likely to be impacts on me from the vaccine as compared to contracting COVID-19? Could you talk a little bit about that decision and what you've seen in some of your patients?
Well, definitely. And I think that it is a difficult decision. I'm a scientist by training, so obviously I have a lot more trust in science because I used to do bench research, et cetera, as a biochemist. But I completely understand that hesitancy. But when, I have a good friend who has COVID long hauler syndrome. And I believe she's on day 103 of documenting her symptoms. And it's just so difficult to watch someone who's 44 years old, who didn't really have a lot of medical problems, and how she's just really, really struggled to get back to where she was. And what's interesting is that actually after she got her immunization, she felt a little bit better. And there's a few stories of those individuals who've suffered from these syndromes, but they've actually had to create new clinics to care for post-COVID syndrome. And it's truly a real thing, and we are studying it and learning a lot more about it. So not everyone, of course, dies. Some people end up having, heart issues later on. Some people just have fatigue for, unexplained fatigue. A friend's mom just had swelling of her legs that just wouldn't go away. All of these different, and she was, of course, worked up for her heart stuff, but, different symptoms and things that, we're seeing with post-COVID, but I don't hear of reports of, people having these things after the immunization. And, immunizations go through a lot of scrutiny before they come to market, as mentioned before. And these mRNA technology has been being studied in HIV vaccines for years, over 15 years. So, people thought everything was rushed, as mentioned earlier, but they've been studying this even in animal models as well. So looking at some of that data and those other things, I think that we won't necessarily see a lot of these long-term side effects that people assume that we will have. And I understand it's a tricky situation, but you would assume that we would have seen those things with other things as well, or the data that they had previously been working on.
Dr. Abdul, I have a 2-part question for you. Are the vaccines safe for most Americans, and do you recommend that everyone receive the vaccine?
As mentioned previously by Dr. Harris, is that from the the group that was selected to give emergency use for the vaccine, they're very trusted individuals. I actually was able to sit in a panel with one of those, is the president of Meharry Medical School. And hearing those scientists and what they have to say, it seems like it's pretty safe. It seems like it's a pretty safe vaccine. Are there side effects? There's always side effects to the immunizations out there. And so those are things that we have to document. So I personally, this is a personal stance, I will never say something, everyone should get anything, because I know that for some people, they may have medical issues that would prevent them from getting something. I'm not necessarily saying the COVID vaccine, because for most illnesses, they're okay, you're pretty much okay. But there are very few subsets where a physician may say, no, you shouldn't. So if you have, other medical problems, I always say consult with your physician first. Like for instance, if you have low platelets or something like that, you may want to consult with them first, because there have been a few side effects from that. So there are very small things that, for certain individuals where they may not be able to get the vaccine, which is why it's so important that those of us who are able do get it, so that we provide that protection for those individuals. And it's the same thing with children. There's some children who can't get certain vaccines because it's not good for the medical conditions that they have. And so that's why we ask for people to get it, so that those children are protected at the time. So I do recommend, if you don't have medical problems, your physician has approved for you to get it, I do recommend that you get it, because it's going to, and as I told a woman on Friday, she's been tiptoeing around everyone because she has lupus. And I said, you've been spending your life kind of in a closet, which is leading to a little bit more depression and mental health issues. And it's like, why don't you get the vaccine? No, you still can get COVID. We're not saying that, but at least your fear of death or, being hospitalized in the ICU is going to decrease because of the immunization. And that data we are seeing. And so I definitely recommend that those who are cleared to get it, go ahead and get it.
So, Dr. Harris, the other question was proposed as well, pertaining to vaccination and DNA changing. And so with that, is that one true, or does the vaccination have anything to do with your DNA? And if so, could you explain more on that?
Sure. So no, it does not change your DNA. It does not cause autism. It does not, that we know of, cause infertility or fetal defects. A lot of these thoughts and conspiracy theories and propaganda, if you will, in regards to the negative effects of it, I think that, it's just an easy way of people saying they don't want to do something because, if you just say you just don't want to get it, a lot of people will, give you that side eye, give you that certain look, right? And so if you can anchor yourself in what you believe to be a somewhat rational reason as to why you're not getting it, then, that's why people do those things. But there's no way that this vaccine is changing your DNA. Your DNA is way too complex, and you would definitely see tons of side effects if it was altering your DNA. DNA is responsible for every single thing that's going on with our bodies, from the way that our hair grows to the way that certain chemicals function and all of those things. So it's no altering of DNA or anything else like that.
I actually have another question from someone in the audience. This is actually from one of my professors, and she said, what are some of the strategies that you are using to encourage people to get the vaccine, and especially those who believe in conspiracy theories that are circulating in the media?
I'll say that I don't spend a lot of time to convince people who believe conspiracy theories in the media. I'll be honest with you, it's not really worth your time, especially I think I focus more on people who may be a little bit hesitant. The biggest thing that we must do is provide accurate information and dispel myths, but actually going that further end of those debates. I have them all the time because I'm a pediatrician and I have tons of parents who do not want to immunize their children. So I typically, just give the facts and show the data. And then sometimes people will share with me their facts and their data. And then I can often show you where there may be holes or discrepancies in your facts and data. And we can just leave it at that. And if you still choose to get the immunization, great. If you choose not to, then we're also going to talk about making sure that you keep other people safe as well and your family.
Thank you very much. I think our last question, you all, this has been such an informative session and we so appreciate you carving out time of your schedules, your busy schedules to be with us today. But our last question is, we had one asking, will life ever get back to normal, or is this essentially our new normal with COVID?
That's a deep question. I think if we can get that herd immunity and get to that, that 90% mark of people being vaccinated, either via infection or via vaccine, preferably via vaccine. But I think if we can get there, then we can get back to normal. And I think it'll be a while. I think it'll be at least another year before we're back to normal and interacting with people. But I think if we can continue to make the progress that we've made, then we'll make some big strides. And the vaccines are continuing to do research to get use in the pediatric population under the age of 16. I believe that Pfizer just filed for their authorization. So hopefully we can get that out, and that way you can extend that herd immunity that will help get us back to normal.
Yeah, so 16 can get it now, which is great. And they actually just lowered it. They're doing the studies now and down to 6 months. So we'll have that data out hopefully by the fall.
And real quick, as we close out, there was a question earlier that I think we did not purposely pass by, but it was just a question about will the people who receive the first dose, if they decide to get it on campus tomorrow, will they receive will the people who receive the first dose just automatically receive the second? Would we still need to sign up? Vice President Powell spoke about that. We would still ask for you to sign up for that second vaccination on May 13th, I believe is the date, May 13th. And so that link will go out. But yes, we would still ask you to sign up for that administration.
Okay, thank you. So this was very informative. So again, we'd like to thank our guests, Dr. Harris, Dr. Abdul-Haqq, as well as Caitlin for joining us today. If there are questions that we were not able to answer or questions that come up once we end, as always, feel free to send those questions to luelt@langston.edu, and we'll be more than happy to get the response to you as quickly as possible. So, as we always do, we will end today's webinar by focusing with our reflecting on resilience. This week, we've chose to highlight our School of Physical Therapy. The class of 2023 received their white coats during the ceremony that was held on Saturday evening. Again, another example of resilience. It was originally scheduled for Friday, but because of the weather, it had to be rescheduled. So the white coat ceremony is significant, as I'm sure some of you know. It's a ceremony that's often held in health-related fields that marks the students' transition from class and lab work into the clinical setting. In this first picture, you'll see Dr. Pollard leading the 14 members of the class of 2023 in reciting the student oath. In the next picture, you'll see Riley Wilson, who is the president of the class of 2023 providing reflections. And you'll see Devon Abram, who's holding his framed copy of the student oath. So congratulations to the 14 members of our physical therapy class of 2023. We hope that you had a wonderful experience celebrating this milestone with your family and friends. And thanks to Dr. Pollard and the faculty and staff of our School of Physical Therapy. So we've come to the end of our webinar. Thank you for joining us. Please plan to join us next Monday, April 19th at 12:30, when we'll bring you the next iteration. Until then, take care, Lions.